Hello, everyone. Good afternoon, and thank you for joining our webinar, Preparing for a HRSA Site Visit for Ryan White Part C and D, the Fiscal Module. My name is Samantha Ritter. I'm the Training Manager here at HealthHIV. I manage our Fiscal Health Systems to Sustainability program, and I'm very happy to welcome Juanita Farrow, who will be doing this presentation for us. Before we begin, just a few housekeeping items to take care of. A little bit about HealthHIV. We operate in 4 core capabilities: capacity building, advocacy, health services, research and evaluation, and education and training. The Fiscal Health Systems to Sustainability program is under the Education and Training Department, and we provide education, training, and technical assistance to any Ryan White funded organization, whether it be a community-based organization, a hospital, a health department. We're here for all of your fiscal and sustainability needs if you're funded through Ryan White. So we're using this Webinato system today. If you check the folder icon on the bottom right-hand corner of your screen, you'll find a couple of documents. We have an evaluation link. We would love for you to take that after the webinar to let us know how we did and to recommend other topics. We have the slides available for download, HRSA Site Visit C&D, and we also have the HRSA-HAB DCHAP Site Visit Assessment Tool, which is updated to 2015. We'll be referencing that today, and it's also here for you to use. If you have any questions, feel free to type them in the chat box. A lot of you have already been doing that already. We are going to try to reserve questions until the end of the presentation. We have a lot to get through in about an hour, but please type them and I'll keep note of them and ask them at the end if there is time. Also, just so you know, you're all muted, but there is an option for us to take you off of mute if you have a specific question and it's easier to explain. So, let us know if that's something that you would like to do. We have a polling question before we begin, so let me administer this poll really quickly. We want to get a sense of who's on the phone with us today. So has your organization had a HRSA-HAB site visit in the past 5 years? And a lot of you are answering, which is great. Okay, so I'm going to stop the poll, and it looks like we have about 57% who have had a site visit and about 42% who have not had a site visit in the past 5 years, but likely, I assume, will in the near future, hopefully. And one more question: were you working at the organization when it had a HRSA-HAB site visit? Great, and the numbers are very similar for this also. About 50% were at the organization and about 46%, so closer to 50%, were not working at their organization. So thanks for responding. This is really helpful for us in guiding this presentation today. And I want to go over the learning objectives before we begin. So what we're hoping that you get out of this, to be able to list the requirements being assessed during a site visit, implement best practices to prepare for a HRSA site visit, and develop a checklist to compile and print all relevant documentation before the site visit begins. I'm going to introduce Juanita Farrow and turn it over to her. Juanita is a founder of Farrow and Associates, a management consulting company and a federal government contractor that specializes in health and human services. And she has also served as a consultant to HRSA-HAB as a site visit consultant for almost 20 years. Some of you might have met her, some of you are going to meet her, and we are very excited to have her today. So Juanita, I am going to turn it over to you.
Thank you so much, Samantha, and good morning to everyone, or afternoon, depending on where you're located. It's really interesting to see the poll, and it seems like almost half of you have never had a site visit. So, the requirement for HRSA is that sites are visited at least every 5 years. So if you haven't had a visit within the last 5 years, chances are they will be coming to see you, or we will be coming to see you if I just happen to be on that team. So in reference to the requirements for the legislative and programmatic requirements for Ryan White, there are some references here that we use to let you know where this information is coming from. So you have the uniform guidance, the 45 cost 75, and of course there are HAB policy clarification notices or policy letters. And then most of you probably know about the website, the CARE Act Target website. There also may be information in the notice of award, especially if there are restrictions or things that relate, special conditions that relate to your award. And then, of course, the funding opportunity announcement, the FOA, which you responded to in your application, and then this tool that we'll talk quite a bit about during the presentation. So, the pre-site visit conference call. But before you actually have a pre-site visit conference call, then you would have received a letter from HRSA. And basically the letter is going to tell you that you're going to have a visit. It's going to tell you what the dates of the visit are going to be. So that's really your first introduction in terms of the site visit. And usually that comes months in advance. So if you start from that point, you've got quite a bit of time to actually prepare for this visit. When they send the letter out, normally with the letter, there are going to be some attachments like the agenda that will be used on the conference call, the pre-site visit conference call agenda. Also, a list of documents that should be made available for the site visit module, as well as we will do a draft agenda. There's a draft agenda that basically we will talk about on the conference call. So there's a lot of information there. Also, for the agenda, it will be based on a 2-day visit if there is only one of the parts that will be assessed, either Part C or Part D. But if both parts are going to be assessed, then usually it's going to be a 3-day visit, and that will you will be told that in the letter. Now, the pre-site visit conference call is a great way to prepare for the visit. And so usually the conference calls are held 4 to 6 weeks in advance of the site visit. And so it's an opportunity on the conference call to ask a lot of questions. Now, you've already received the information in advance with the letter that you received from HRSA. And so this is an opportunity after you've gone through some of that information to be on the conference call if there are areas for clarification or just discussion basically on the call. So on the conference call, in terms of the format for the conference call, prepare for the call in advance and review the documents, because these are the same documents that we're going to be talking about on the call. You may be asked to explain your model of care, and the reason for that is generally we want to understand a little bit better in terms of whether or not we'll need to go to other sites, especially for a recipient that basically contracts all of the medical care to subrecipients, whether we're going to need to travel, basically how many subrecipients they are, or where actually the services are being provided or how they're being provided. So all of that information will be discussed on the call as well. And most of all, if possible, make sure that you have key staff on the call. So especially someone from the finance department to be on that call. So it's really important to try as much as possible to communicate directly with the individual that will be responsible for doing the interviews and preparing all the documents in advance. And if for some reason that finance person cannot be on the call, then there's always the option after the fact to try to have the fiscal consultant actually talk to that person individually after the conference call. But if much as possible, if they could be on the call, that would be great. So the call generally lasts about 60 minutes. And so on the call, basically, we'll have introductions. We'll hear a little bit about the recipient, their background, mostly the positions that they hold. You'll hear from us a little bit about our background, so you get to know who the team is. And we'll confirm the date for the visit. And usually it's the project officer that will talk about the purpose for the visit, and especially related to the fact that we're there to look to determine how you are complying with the legislative and the programmatic requirements. But you're going to hear over and over and over again on the call is that this really is also a technical assistance visit. Even though it's called a comprehensive site visit, there's always the opportunity to provide technical assistance on site. So look at it in that light. And if technical assistance, because of the amount of time, it's very limited, the amount of time that we have on site, if technical assistance cannot be provided in that short period of time, then certainly it's a recommendation for technical assistance to be provided after the visit is over and to request that from HRSA. So you can even be thinking about areas if you just know that there are some areas that you're going to need technical assistance. There is an opportunity to really think about what those areas are. So then we'll talk about the roles of each of the team members. Usually it's an opportunity for each team member to talk about what their expectations are on the visit, how they conduct their reviews. It's a little bit different for each consultant. So you'll hear from them in terms of what their expectation will be and who they would like to talk to on the visit. We'll verify that everybody has all the information that's been sent out. Which you would have received, most of which you would have received with a letter, but for the consultants, we also get some preliminary information as well that's uploaded for us to review, like the applications, the NOA, we'll get A133s, information like that we will have, and we use that as well to prepare for the call. And then we'll have the opportunity, since you'll have a draft agenda, to sort of firm up the agenda and talk about all, specific things related to the logistics, who should be included, if any subrecipients should be visited, and sometimes it's not possible because of the amount of distance in some cases. But we'll go through that, and you'll kind of understand the time frame for each of the days in terms of how the visit will be laid out. And usually that's on the agenda. And then usually you'll be asked to, insert the names of the people that we'll be meeting with in each of those areas, and then we'll finalize the agenda certainly before the visit. And I'll talk more about the agenda later. And if there are things that need to be addressed specifically, it is a comprehensive visit, so we'll be looking at all your whole program. But if there are specific things that need to be addressed based on the application review or other documents or information that have had, then certainly that will be discussed on the call as well. So the list of documents, now I would say this is probably the worst case scenario in terms of the amount of information, and it was compiled. It's certainly more extensive than what you might receive from HRSA, but sometimes the consultants have, will say that they will send you a list of documents that they would like to receive. It might be a little bit different for each consultant, depending on, the things that they would really want to look at. So this list really is sort of all-encompassing in terms of a lot of information. So if you prepare based on this, you should be definitely prepared to do well on your visit in terms of the information that needs to be reviewed by the consultant. So some of the things that basically we'd want to see, just looking at this list, would be, of course, your contracts and your amendments to those contracts, MOUs, any type of agreements that you have that relate to your Ryan White program, your continuum of care, those types of things. For 3 years of agreement, some consultants may only want to see the most recent year of agreement, but we'd like to see signed agreement. So what you present to us is basically what we will use to as part of the assessment. So we'd hope that they would be signed. The subrecipient monitoring policies and procedures, and that's really interesting because that's an area that sometimes recipients may not have in place. You know, they have great relationships with their subrecipients, but they may not necessarily have a comprehensive policy and procedure in place for how they monitor their subrecipient. So it's always good to have, you know, some type of document that really explains how you monitor your subs, and included in your agreements as well. You need to speak to some of those things, but as part of your policies and procedures, this should certainly be one of them, to help understand how you monitor the subrecipients and how you ensure that they are compliant with the Ryan White legislative and programmatic requirements. So we'll be asking for subrecipient contract files, because that will tell us how you monitor the subrecipient. And I always say, even if we did not go visit a subrecipient, we should know and understand, based on our review at the recipient offices, based on the documentation for each of the subrecipients, how you are actually monitoring those subrecipients, looking for, you know, monitoring tools or anything that you use to determine whether or not they are compliant. So last 3 years of NOAs, the FFRs, and basically we're looking at the FFRs, well, first the NOAs to see if there are any special conditions of award. The FFRs, if there are any unobligated balances. If you've had a series the last few years, unobligated balances or money that wasn't spent for whatever reason, and we want to understand more about that and why, you know, all the funds were not spent. And then, of course, approved budgets and copies of the most recent budget, any budget revisions or anything like that. I also would say that because you have some latitude to make budget changes on your budget, whatever budget you are using, certainly the approved budgets and any formal budget revisions, but whatever budget you are using, please share that with us, so that when we are looking at your expenditures, that we have that information available to us. Sometimes, you know, recipients make, you know, changes, revisions, and they're showing us a budget that's been approved, but yet it doesn't coincide with the expenditure. So we need to know exactly what you're using to actually monitor your expenditures. Any carryover request information we'd want to know. There's been a recent, well, it doesn't necessarily have to be recent, but the most recent HRSA site visit, whenever that was, if possible, we'd like to have a copy of that report. Sometimes we can get it from HRSA, and sometimes maybe not, but if you have a copy of that, we'd want to see that. The organizational chart for the fiscal department and how basically the structure of that, and, you know, who is included in that in terms of positions and things like that. It's always helpful for us to see that, because that really speaks to the separation of duties, to see how, see who actually is responsible for what particular areas. Bank statements, we look at the most recent quarter, monthly statements for bank reconciliations. We'd review that, you know, and they're basically, again, looking at who prepares the bank statements and how the bank statements are reviewed. If there's another level that's responsible for review and approval of those statements, that would be something that we'd want to see. If there's any inventory that's being purchased by the grant, in most cases there's not, but if there were, you know, we'd want to see the inventory list. And lastly, on this page, payroll information. So we want to look at, the payroll register and then the source document, basically, which would be the timesheet for a recent pay period. Some may want, the past quarter, but you would know that before they came what they would want to look at. And then some way of verifying that the payroll taxes have been paid and are up to date. A lot of information here, so just trying to compile as much as possible that could be asked for in the fiscal area. So time and effort report, your most recent time and effort report, and this would speak to basically for the Ryan White program specifically, and if the person is being paid on a different funding sources, of course, is there something that actually certifies that they spent the amount of time. Now that could be a timesheet that's developed, or whatever system you have to certify that that time has been spent on that program is the actual time spent on the program, not what was budgeted, but the actual time that has been worked on that particular program. And sometimes it's done based on the budget, which is budgeted time, but the actual time that's spent is what we would be looking for in terms of the time and effort, a certification to that effect by the employee and signed off by a supervisor. Accounts receivable report, just looking at basically how we're collecting insurance money, money from third-party payers, and also accounts payable, looking at how we're paying our bills, if we're, not able because of cash flow to pay the bills in a timely manner, especially to our subrecipients and how they're getting paid. That's something we want to see. And by the way, don't pay any attention to the actual dates that I have here. Obviously, the dates are going to change depending on where we are, so these are just dates. But you would know, based on your conversation with the fiscal consultant, what specific time periods they're going to be looking for. Remember to ask those things. Okay, so now moving on to drawdowns. So your drawdowns, we may ask you to look at, two grant periods for your drawdowns. The current period, especially if it's just started, and then the previous period of drawdowns. And what we would expect to see is support documentation for that, like expenditure report, so we can determine basically how the money was drawn down. If we are drawn down in advance, we would want to see how that's being done, because there are specific regulations related to advance draws to minimize the amount of time that you're actually holding on to grant money. And so there would need to be something to demonstrate that you're not just drawing down and holding the money, but you're drawing down and, spending the money in a timely manner, and then projecting the next amount for advance. Report from your accounting system, and that's basically just to determine what the capabilities of your accounting system are. Do you have an accounting system that you could actually go and pull reports, and it would be accurate based on your chart of accounts and things? So that basically speaks to that. Budget detail for other Ryan White grants, and the reason that is there, especially with the budget detail, is to try to understand what we're spending money on and how money is being spent between your Ryan White programs, to sort of determine what's covering what. And so the budget detail is usually asked for to understand that. And then, of course, year-to-date expenditures on each of the programs to understand how we're spending money, if we're able to spend money based on all of our funding sources. The chart of accounts, of course, provides guidance in terms of how we are able to allocate our funding based on line item, based on funding sources. So, And usually with a chart of accounts, I don't ask to have this information printed or anything. And most of this information, much of this information, sometimes we just get a flash drive with documents on the flash drive, and that's presented to us once we arrive on site. Kind of neat nowadays that we don't have to do a lot of printing anymore. Many of the documents can be provided right on a flash drive, and each of the consultants receive their own little flash drive now. But again, if it's more convenient for you to print the document, then that's fine too. It's whatever is easier for you, actually. So we talked about the chart of accounts, basically. And so the total operating budget and the financial statement for the HIV program, basically, because you have not just Ryan White dollars, maybe you may have other funding sources. So we basically want to know, and even, operational dollars that's provided by the institution. So whatever you're using to support the program, to have, an understanding of that based on the budget. So the financial statement and then the package of financial statements, basically I'll take those together, present it to management. That just speaks to information that is reported upward. So, the program may have specific information, but if there's a division or something, we'd want to understand what information is reported where the HIV program is included in up the chain. It may be to management in a large institution. In a smaller institution, it may be included in the financial packet that's reported to the board. It may be part of a consolidated statement. But however the financial information is reported up the chain, basically that's what we're looking for there. And that speaks more or less to oversight, is that somebody is looking at, what is happening within the Ryan White program as far as expenditures. The financial reports, of course, source documents, when we look at the expense reports, we may ask for support documents to actually clarify some of the expenditures, and also there looking for whether or not something is allowable, whether it's an allowable cost. Then the last thing on that page relates to the RSR report. Sometimes we'll ask for the data report if that's available. I know you're not required to do that now, but sometimes that provides a lot of good information as well. So your audit report, we'd want to see your most recent audit reports. Most of the time we get that in advance of the visit. But also, if you have subrecipients and you have oversight for those subrecipients, of course, if the threshold applies to the subrecipient and they're required to do a single audit, we, as part of monitoring your oversight for the subrecipient, we may want to see basically documentation that you have on file related to review of the subrecipient audit report, which is one of the requirements in terms of your oversight of the subrecipient, is for you to review that information and document that you've actually reviewed that. And if there's a corrective action plan, to know that there is a plan in place to resolve some of the issues. If there are issues on the findings on the audit report, how those findings are resolved, and whether or not you have a process in place to resolve findings for any report, even site visits. I know there's a corrective action plan, but how do you get things resolved that turn out to be findings? Policies and procedures, of course, procurement policies and procedures, a list of all your HIV funding streams and information related to that, and sort of understanding basically what's paying for the services related to your HIV. Billing and collections policies and procedures, of course, the sliding scale, and making sure that the sliding scale is specific to the Ryan White program, which means that under 100%, that it actually demonstrates that under 100% of poverty, that the patients are not charged or are not, responsible for paying anything. The fee schedules, basically a listing of, which is different than the sliding fee, of course, but your scheduled charges to demonstrate what charges, ordinary customary charges, basically for outpatient services. And then policies and procedures relate to the monitoring of your cap on charges to ensure that patients are not paying above the cap on charges, which is based on their income, and policies and procedures related to eligibility screening, your financial intake. Basically, this is all policy information. Sometimes, a consultant will ask to pull a certain number of charts to look and review how the eligibility screening is being done and the documentation that supports that. So records relating to tracking, reporting, and the use of program income. Now, this is a big one because program income is definitely, especially now, where we are, with ACA, HRSA is looking really hard at, program income that's being generated. Certainly, it has gone up in most cases related because of ACA. And so looking at that to determine how we are tracking that program income and that it's being reported on your FFR and how we're using the program income, because you have to basically show us how the program income is being used to further the HIV program. And sometimes you have to make sure that when we are looking at the program income, there's something that we make sure that it's allowable cost. So it's not just that it's being used, because you know that it can be used for additional administrative support. And that's what we always say when we talk about a 10% admin cap as well. You've got program income, and so that gives you some extra money that you can use for those administrative things. But it has to be allowable. You can't use program income, for instance, to provide, money or cash to a patient or something like that. That would be unallowable. And also related to that, subrecipient monitoring. Now, your subrecipients may very well be keeping the program income. That's fine. However, they still have to report to you what the program income is, how much, what it is, how much it is. You do not report the subrecipient's program income on your FFR. You only report program income that you have generated if you're providing direct services. Now, I've had a couple of these recently. If you don't provide any direct services and it's all being provided by your subrecipient, then you do not report their program income on your FFR. So, but it is expected that they will report it to you, you will monitor it, and you will also know how it's being spent to support the program, and you will be able to demonstrate that it's based on allowable cost. Okay, so travel and reimbursement policies and procedures, and then there may be a request to provide a report for us in terms of the number of visits by your provider. How many patients are, the provider seeing for a certain period of time, and that sort of help us to look at workload and those types of things. And sometimes, to support, time and effort on how much time is being allocated on the grant, to be able to see the workload associated with the providers. Okay, So now let's talk about the agenda. So remember, all that information you're going to get on that conference call. So you would have had a chance to review it. If there are any questions about any specific thing, then there's your chance to ask for clarification of that. But you will be talking to this fiscal consultant in terms of what they are going to be looking for that area. For the agenda, which will also be discussed on the call, this is for a 2-day visit, for instance. It's laid out for the 2 days in terms of an entrance conference, which would be the beginning for an hour. And during the entrance conference there, it's an opportunity for us to do introductions again, and then also to talk about the purpose of the visit while we're there, and for you, as part of the overall site visit, to do a presentation related to the services provided and any update related to the program. Fiscally, it would be good to talk about things related to, other funding sources, related to, I just lost my train of thought. Payer sources and those kinds of things to help us understand, especially the number of uninsured, impact of ACA, those kinds of things, challenges, successes, questions and answers, and then we'll review the agenda. So basically, everybody has their own track in terms of what they're responsible for. We do a tour right after the entrance, and then each of us break out into our separate areas. And we kind of use at least I like to do that in most of my visits, kind of use the tool, the layout of the tool to, there are 4 requirements in the tool, and kind of use that to use as a way of laying out the agenda. Oops, sorry about that. Second day, basically, it's pretty much the same. At the end of the visit, I didn't mention, let me just go back, just because I like to make sure that we know that because it involves money. If there is a consumer meeting, we would ask probably for you to provide lunch for us, and then we would reimburse you, make sure that, we reimburse you for whatever our portion of the lunch is. And then on the second day, we pick back up, finish the review, and then it's sort of in the afternoon, it's really just wrapping things up. There may be a pre-exit conference if there's something that's very specific that we would not want to talk about in the exit conference. Then we would reserve a pre-exit for that. If there was some issue related to inappropriate spending or something that was pretty major, or even a personnel issue of some sort, we might want to use a pre-exit for that. Some recipients want to have a pre-exit, or we do it as a courtesy just to kind of let senior management know what the information is going to be presented at the exit. So it could be used either way. And then, of course, at the exit meeting, that's our opportunity to tell you in the fiscal area what all the findings are in the fiscal, whether or not they're legislative or whether or not they're programmatic, which if they're legislative or programmatic, you're going to have to respond to those. If they are just improvement options or best practices, you wouldn't have to respond to that. But legislative and programmatic will be part of a corrective action plan that HRSA usually talks about in the exit meeting when they wrap things up in terms of next steps. And then all these things take place on the call in terms of the review process. So all the information you're getting now, it's part of your conversation on the conference call. So the tools basically you will have on the call, and pretty much they just provide an overview of what the reviewers will assess. And you can use the tools as a self-assessment tools for you to actually determine how prepared you are for the visit. Do like a mock survey of some sort. And, the tools are updated on a regular basis. So, just HRSA will send out the most recent tool when they send out the letter to you. So now the tools, the fiscal tool, there are 3 different tools. For clinical, there's one for fiscal, and there's one for administrative. So you'll get all the tools. So if you turn to the fiscal section of the tool, basically, and you would look at the requirements for that. And so the first requirement, one, for fiscal has to do with the budget and use of funds. So looking here, you'll see listed the authority, where that is coming from, where the guidance for that is coming from, those sections, and then basically the things that will be contained in that area. Now, I'm not going to go through all the detail related to each of the requirements because much of that you already got when I talked about the list of documents. And so, I won't go through the level of detail that I did for that. However, the main thing here is how are we spending the money? It's to make sure that we're spending the money according to the legislative requirements, that we're not using the funds to, for unallowable costs, or that we are to make sure that we're monitoring based on the cost categories, with EIS and core and administrative. This provides guidance and to ensure that we're doing that. Also, allowable costs. I want to mention that is to make sure that all what is being spent is allowable. And then just to emphasize. Let me see if I can do the right here. So for the maintenance of effort is you basically determine what your level of maintenance of effort is each year, and that is so that you are consistent with your maintenance of effort and it's your non-federal funding, and that you maintain a level of, non-federal funding, and so that it's not less than the previous year, that we're maintaining that same level. So you have federal funding, and then you have non-federal funding that supports the grant based on, what you're saying that it will be in order to support HIV services. And if you start to decrease that non-federal funding and you're pushing more and more things or support towards your federal funding, that would be an area that, would have to be looked at, because maintenance of effort basically says that we're maintaining the same level of effort, and this relates to the non-federal dollars. And that's what it looks like. The module just gives you the documents, and for each of the requirements, it goes through each of the areas. And we have to determine whether or not you met or you did not meet that area. There used to be a partial, but the partial is not in there anymore. So you either meet it or you don't meet it. And so it's your responsibility to help us to see how you are meeting or complying with that particular requirement. Again, great tool for you to use as a self-assessment to do that. Couple of examples here. One related to the budget is that the financial report should demonstrate budget to actual year-to-date expenditures. So when we're asking see financial report, we're wanting to see basically how you're monitoring your budget. And so that means that you have budget to actual, and that also the financial reports are monitored based on the cost categories. So that and you can tell based on your financial reports, you're tracking based on cost categories. So where you are in terms of your administrative cap, and whether or not you're maintaining that 10% or if you're over that 10%. So make sure that when you are tracking information that you are able to demonstrate that you are tracking your expenses or expenditures based on the cost categories. And subrecipient monitoring, again, is looking at those files to determine, invoices, what's been paid, any performance reports, audits, whatever you're doing to monitor your subrecipients. Make sure that that information is available and updated. So the second requirement has to do with fiscal management and oversight. This is basically the guidance, policies, what you use to be able to provide guidance for how things are done fiscally for your and to ensure that you are complying with the legislative and programmatic requirements. So this has a lot to do with policies and procedures. It has to do with oversight, from board management all the way down. So policies and procedures, in the module, it does list specific, policies and procedures that we will be asking for there. So making sure that you have that information at hand. In terms of board oversight, down here. So, it really is about accountability here and ensuring that there is, fiduciary responsibility and oversight from, top management. So it may be looking at minutes from the board, especially what's being reported to the board, but also that the board, in terms of your audit, that, the audit has been presented to the board, the A133 has been presented to the board and discussed with the board, and the board is aware of that kind of information. It might be if there's a finance committee, maybe minutes from the finance committee to demonstrate basically that, again, another level of accountability there. Or it may be management meetings, things along that lines where there's discussion about the program and the finances of the program. So basically, we're sort of looking at the oversight of the finances of the program and where that's going and who's getting that information and where the accountability is. And, of course, whether or not there's audits being done and, who the follow-up for the audits and getting any issues resolved. And that's what, at least one of the pages, we didn't copy the entire section, but, that just gives you an idea of, the types of questions that you would be asked in that particular area. And some examples of requirement 2 for fiscal management and oversight is, again, the policies and procedures, especially related to internal control. How do you ensure that you have internal control systems and processes in place? And so you want to talk about things like separation of duties. You want to talk about things like oversight and anything that speaks to the internal controls within your organization. And the other area here that I touched on when we talked about documents a little bit, a list of documents, is related to your, the timesheets, how payroll, the payroll process and how time is being allocated on your timesheets and being allocated based on the funding source, especially when someone is paid off a number of different funding sources, is to understand that process in terms of how that's done, and also to know that it's based on actual time that's worked. But again, refer to the 45 CARF 75 for additional information on that. But it needs to be based on actual time work, time and effort reporting, and not just based on the budget. and what's budgeted. Because just because it's budgeted, it doesn't necessarily mean that someone worked that time actually on the grant. Because things happen, people get pulled away in different areas, and so we want to make sure that what we're presenting is actual. Requirement 3 relates to the billing, third-party reimbursement, collections, and program income reporting. Again, each of the requirements lists the authority where you can actually go and get additional information to make sure that you're compliant with all of these areas. Most of this I've talked about, but the last one relating to eligibility and recertification of patients and making sure that Ryan White is a payer of last resort is so important, is making sure that we have policies and procedures in place specific to how we do eligibility screening, and that systems that you use to ensure that Ryan White is the payer of last resort. And that's what, in that particular section, for requirement 3, those are some of the things that you would be each of the questions. Remember, in each of the area, it's either met or it's not met. So if there's something in there in that particular area on each one of those lines, if there's something not met, it just means that doesn't mean that the whole requirement is not met. It just means that that particular line is not met. So, for instance, if in the first one it says that the organization report program income on line in, maybe they have it and maybe you're monitoring it, but then it's just not reported on the FFR. So then, that particular area is not met. But the fact that it's being reported or the fact that it's being monitored and tracked, and you know how you're spending it, and it's allowable cost, I mean, all of that may be fine. Again, in terms of demonstration, I've talked about the eligibility and recertification policies and procedures. You may be asked to pull some charts, or charts will be sampled to look at the eligibility screening. And then program income, I can't emphasize that enough. So all of those pieces have to be in place for program income to make sure that it's tracked, reported, and reported on the FFR, and you know how it's being used. For requirement 4 relates to sliding fee discount and the cap on charges. Again, the authority for that is listed, and we, of course, would look at policies and procedures and basically how you're monitoring how you've implemented the sliding scale so that it's specific to the Ryan White program, which is very specific, and that no patients under 100% of poverty are charged for any services. So that should be 0 related to the sliding scale. Now, charges can be imposed for patients who are over 100% of poverty. And, how you handle delinquent accounts, and I think pretty much that area is covered. So here again, these and each of these columns, each of these categories, each of these rows, it lets you know whether or not that particular item, whether or not that's a legislative or programmatic finding. So when it's reported out at the exit conference, you would know whether or not that was a reported, programmatic or a legislative. So takeaways for the sliding fee and the annual cap on charges. Policies. You've got policies and procedures, and you can demonstrate that it's implemented. I've heard some recipients say, well, I've talked because of our population, and, it's very rare that someone would exceed the cap, in terms of of charges imposed. Now, remember, the cap that you are monitoring is not based on what the patient has paid, but it is based on what charges have been imposed to that patient for HIV services, and whether it's at your institution or whether it's some other place that they've gone where they have received a bill or they have charges that have been imposed. You have to be responsible for making sure you have a system in place to ask them that and to monitor that cap based on that. So patient's responsibility here to make sure that they are giving you that information, but that you are asking that information to determine whether or not they're meeting their cap based on charges imposed for Ryan White services, and that you have a system where you're tracking that. Here are some best practices that I think are always good. Is that you have, it just makes it easier for the team. I think for the review as whole, is that there are workspaces for each team member. It can be no more than just a little small, tiny cubby hole, but that we have a space that we can actually work in. To do our interviews. It can be in the offices. It's just much better than all being in the same conference room trying to do interviews in the room, because it's very distracting, especially if you've got, somebody else, all three consultants in there trying to interview. Lunch accommodations, here are just some tips for best practice. It's reasonable. Make sure it's reasonable. We had one time where recipient just kind of went all out and had a pretty nice spread for the patient, and of course we have to pay for our portion of that, and it was quite expensive. And our per diem is only but so much, so we don't necessarily have to have that. So just we eat whatever the patients eat, but it can be very inexpensive. That's fine. Decide the subrecipient's location to be visited. Yes, we definitely have to do that before we get there. And the team usually has a car, so the team will be able to drive wherever that is. Prepare the staff for the visit. And I always say that is make sure, not necessarily just the people on the Ryan White program, but, if there are other people who are taking care of, the HIV patients, is that they're part of the process, to feel part of the process and to understand what's happening. But make sure, above all, which is the last bullet there, is that there is one person who is responsible for making sure that all the other areas are prepared as well, so that it's not information that's just being given to a particular area like admin or just a physical or clinical, but that that someone follows up to make sure each of those sections have actually gone through and have been able to demonstrate that they have information in place for all of those areas. Start preparing early. Use that conference call. I can't stress that enough. That is for you. Make sure that the documents are pulled in advance. We have been to sites and we have not seen documents at all pulled. So we wonder, because we stressed that on the call, and then we've gone to the site and it becomes, now, what is it that you need to see? So, that's why we have the conference calls, is to make sure that we're on the same page in terms of information, because if we have to wait to get information at the last minute while we're on site, and I've seen this quite a bit, and you're getting pieces of information, you can only do but so much that way. So if something doesn't get reviewed, then we can't be responsible for that. We will do as much as we can, on site, but if we have all that information in advance ready for us, we can go through it fairly quickly But if it's not there and we're having to wait in between for each piece of information to come to us, then that really does take a lot of time. And at the end, that really, it hurts the review process. Use the physical modules as a self-assessment. We said that. Talk about whether or not you want to have the information printed or on a flash drive. Certainly for most consultants, a flash drive is that's the preference. But again, have that discussion. We'd like to have a central location where we can always come back to. Usually that's kind of what we call a home base. That way the team can have a designated area when they need to come back to conference as needed. Be proactive. You will know what your strengths and weaknesses are. And again, this process is really a very friendly process. I cannot stress that enough. Having done these reviews for over 20 years, it is a very, very friendly process. And, in terms of technical assistance, there's a lot of technical assistance that's provided on site, as much as possible. And to look at it that way as a technical assistance opportunity. And also request technical assistance to develop action plans to maximize one-on-one learning opportunity. So if you know that, there's an area that you're just going to need more technical assistance, certainly, let us know that, and we will know that, and we will definitely be able to put that in a report as well. So that will give HRSA some backing. If they need to, move that forward in terms of that additional technical assistance. Okay, so I am going to
Thanks so much, Juanita.
You're welcome.
Thank you. So I want to be mindful of time for those of you who have to jump off at the hour. Just a few more housekeeping things. This webinar is being recorded. We will post it on the Target Center and on our website in the coming week. We will stay here for questions for those of you who want to stay on the line, but I just wanted to make sure that I told you that. And I also wanted to reiterate that, use this as an opportunity to get help on the things that you might be behind in. If you don't have a policy, for example, for sliding fee scales, but that's something that you need, don't just wait for the consultants to get there and tell you that you don't have it. Try to develop one of your own so that when they do get there, you actually have something to show them so that they can help you build it together. And we have, Juanita, if you don't mind, 2 questions already that I would like to ask you. And folks, if you have other questions, please feel free to type them in the chat box now. The first one that we've gotten a couple different questions on, how does the site visit work with subrecipients? Do you also need to have, for example, all of the files and the documents that you've mentioned that the recipient needs to have? Do the subrecipients need to have all of those as well?
Well, the subrecipient review is going to be very much abbreviated. So the physical consultant is going to let you know what they're going to need to review for the subrecipient, but usually that review is probably no more than 2 to 3 hours. So usually if the team goes in, there may be a tour, there may be a sit-down where there is some discussion among the team and the staff, the HIV staff, and then there might be a request to see, what documentation do you have for sliding scale. The expectation is that they have to comply as the recipient, but therethere's no way that the consultant is going to be able to review the same level as the recipient, as you would do for the recipient.
Right.
The recipient is expected to understand that organization is compliant. So what we're sort of doing is then testing based on what we've seen at the recipient's office, that they are monitoring, and it's a way to verify and test that that's being done. A lot of it will come from the front office and the billing piece to make sure that that's happening. But have that conversation with the physical consultant in terms of what they're going to be specifically looking for so you can let the subrecipient know.
Great, thank you. And another one, so for some folks who haven't, for example, had a site visit in 10 years, folks who have had one a couple of years ago and are just having one again, do the documents or how far back you go, does that depend on when your last site visit was, or is it standard no matter how much time has gone by since your last site visit?
No, it's going to be the same. I mean, if we're going to ask for 2 years, we're going to ask for 2 years, whether, it's been 5 years since you've been visited or it's been 10 years since you've been visited. So that is what the fiscal consultant needs to let you know. That's what that conference call is about. You haven't been visited in 10 years, then the question is going to be, you want to see the last 2 years or do you want to see more? And most of the time it's only going to be, the last few years. It's not going to vary depending on whether it's been a 5-year visit or it's been 10 years that you've been visited.
Great.
Does that answer the question? I mean, okay.
That does answer the question. Yes, that answered the question. So I think those are the main questions that we have for now. If anyone has any follow-up questions, don't think that the end of this webinar is the last opportunity for you to ask questions. You can email us. We have on the screen right now training@healthhiv.org. We're happy to answer any of your site visit questions. We can certainly forward any specific questions to Juanita for follow-up. And if any of you are interested in receiving technical assistance, if you'd like to prepare for a site visit, if you had one and want to walk through your corrective action plan, we're certainly happy to work with you on that. And I see just a few other housekeeping questions. We're emailing you the slides immediately following the webinar, and the slides and the recording will be available on the Target Center and on HealthHIV's website. So thank you, everyone, for your participation today. And Juanita, thank you, as always, for a fantastic presentation. And we'll keep the webinar open for a little bit just so folks can download the slides if they haven't already. But thank you very much, and I hope you have a good rest of the day.
Thank you.